This conference will now be recorded.
I'm so sorry, in between some technical issues. So we were talking about the reproductive health, right? So we need to conduct awareness classes, or we need to give exact idea about the reproductively healthy society. So safe and hygienic sexual practices, that also people should have an idea about that. Then sexually transmitted diseases or sexually transmitted infections like AIDS and all. We need to give a clear message or clear idea about that diseases which are transmitted through sexual practices, right? So the adolescence and associated changes, then safe and hygienic sexual practices, then about reproductive organs, then sexually transmitted infections. So about all these, we need to create awareness among people. So these are the primary steps or the initial steps we need to take towards a healthy reproductive society. And we need to conduct programs, awareness programs to make a healthy reproductive society. So the primary steps we need to take is to create awareness among the stages of reproductive stages or the changes in body during adolescence, then safe and hygienic sexual practices, then sexually transmitted diseases. About all these, people, society should have a clear-cut idea. Then only we can create a healthy reproductive society and healthy reproductive programs for healthy reproductive society. Then we need to provide medical facilities for all these problems. So if you are providing medical facilities for all the problems like menstrual irregularities, see many of the ladies, so many women, they are suffering from menstrual irregularities, irregular periods. So due to that also, so many problems will come in the body. So menstrual cycle, that should happen regularly. So menstrual irregularities also may create issues or problems, and for that we need to provide medical facilities or medical treatments to solve such kind of issues, and pregnancy related aspects, then medical termination of pregnancy. We should tell, or we should create awareness about the importance of this medical termination of pregnancy. Legal medical termination, that is very, very important. Legal medical termination of pregnancy, which is allowed, or we should not allow the illegal medical termination of pregnancy. Okay, and sexually transmitted infections and birth control, then infertility, then maternal and postnatal care. All these are important aspects of reproductive health programs. So we should provide medical facilities and proper knowledge. We should create awareness about all these problems, and we should provide medical facilities to solve this kind of issues. So in reproductive health, an overall improvement is there, because maternal and infant death rate or mortality, that is very less now compared to earlier period. Now the infant mortality and maternal mortality both are very, very less, because time to time checkup or the medical treatments and the awareness, all these are reducing the mortality or the death rate. Then the medical treatment facilities which are available for the diseases, and to assist those infertile couple, those who don't have children, or if they are infertile, for that also now solutions are there. Medical treatment facilities, everything is available, and timely detection timely detection itself may help up to 80 to 90%. So first we need to detect, then we need to provide medical assistance for all these issues. So why this mortality rate is less now? Why? What is the reason for this less mortality or less death rate? Because due to the improved health facilities. Now health facilities are improved and the living condition, better living condition, both provides a less mortality or less death rate. Both a combined result of this improved health facilities and better living condition. Both results in a less mortality, or mortality rate of that is very, very less nowadays. So that is the reason for a population explosion. If the death rate is less, obviously there will be a population explosion. There will be an increased rate in the population, right? There is a increase in the population now. Why? Because death rate is very less and healthy living conditions are there, then improved medical facilities are there. All these provides a healthy society, or mortality or death rate is very less. So definitely there will be an improvement or the explosion in the population. So the population explosion that created a situation of demanding this contraceptive methods, right? If there is an increased population, we need to control the population. We need to maintain the population. There should not be an explosion or a huge increment or huge increase in the population, because a population explosion may create so many issues, right? For the basic needs also we will suffer. There will be a food scarcity. So such things may come in the future. So to prevent such things, we need to control the population. So for that makes a demand for the contraceptive methods or birth control methods. Contraceptive means birth control method. So there are so many contraceptive methods which are available now. Natural methods are there, traditional, then pills, injections, surgical methods, all these are contraceptive methods. So these are used to avoid the pregnancy. These methods, natural methods, then pills, injections, surgical methods, all are used to improve these are used to avoid the pregnancy. All these are used to avoid the pregnancy. So up to this we have learned in the last class. Up to contraceptives we have learned in the last class. Now we are moving to medical termination of pregnancy, then sexually transmitted diseases, then infertility. We are going to discuss about all these things. So in this you may get, for board exam you may get questions like different medical termination methods, medical termination of pregnancy, different methods used for that. And for NEET you will get so many questions, MCQs from this part, because it is very important that medical terminations with medical termination for the pregnancy which we are using, that's it. Those are very important topic for NEET. You may get so many questions from this. So write down the notes. So first we are going to medical termination of pregnancy. Short form is MTP. It's called as MTP, medical termination of pregnancy. So medical termination of pregnancy is otherwise called as abortion. Abortion. It is also called as abortion. No, normally or commonly we are calling it as abortions. So abortion that may occur due to many reasons. By unknown reason, that means it is called as miscarriages and those caused out by human inventions in pregnancies, right? So that means if there is any medical issues in that pregnancy, or there is some medical issues may come during the growth of that fetus. During that time, you are forced to kill that fetus, or we are forced to terminate that pregnancy. So that is also called as medical termination of pregnancy. So abortion may occur due to many reasons. Some reasons like miscarriages. Miscarriages that may happen in many ways. Miscarriages means due to some sudden fall or something. Such things also may cause miscarriage. And those caused by human inventions. Human invention in the sense, in the growth, during the growth period of that fetus or that embryo, there is some medical issues. Doctors may suggest for a medical termination. So such things. So it is called as medically terminated pregnancies. So such situations are called as medically terminated pregnancies. So before fetus becomes viable, this medical termination is done. Okay. So when we'll do that medical termination, if there is a medical issue or any issues for that growing fetus, or if it is creating any problem for that mother, doctors may suggest for a medical termination. So such medical termination of pregnancy, it is done just before the fetus becomes viable. Okay. And in 1971, in India legalized this medical termination of pregnancy. Here, so invention or voluntary termination of pregnancy before full term, it is called as medical termination of pregnancy or induced abortion. This medical termination of pregnancy, it is normally called as abortion. So what is that? It may occur due to many reasons, like voluntary termination of pregnancy before full term, before completing the growth of that fetus, that growth of that fetus is terminated. That is called as medical termination of pregnancy or induced abortion. The abortion is induced. It's not happening normally. It is induced, like it is forced to terminate. Okay. So it is called as medically terminated pregnancies. Right? Nearly 45 to 50 million MTPs are performed in year all over the world. So in all over the world, nearly 45 to 50 million medical termination of pregnancy, it is done. So in Government of India, MTP, medical termination of pregnancy, is legalized in 1971 in India. So such restrictions, they are more important. Okay, that is more important to check the indiscriminate and illegal female fertilizers. Okay, so what is that? See, there is a practice of killing this fetus before birth. Why? Because if it is detecting that there is a female baby from the womb itself, they are killing, right? Because normally there is a concept that female or lady, girl baby means it's a headache. That's a general concept or general way of thinking among normal people. Girls means it's a tension. So such kind of thought that will bring them into a situation to decide that we need to kill this baby. So Government of India, they legalized this MTP in 1971. Okay. Next. This casual or unprotected intercourse or without this contraceptive intercourse, such intercourse may cause unwanted pregnancies, right? How this unwanted pregnancies are happening? Unprotected intercourse or without that contraceptive, without using any contraceptive method, intercourse is done means that may cause unwanted pregnancies. So then due some in some cases, it may be due to rape or there is a chance of unwanted pregnancy in such cases. So to avoid such pregnancies, these MTPs are allowed. Okay. In the case of rape and all, if that lady, if she's becoming pregnant, in such cases, these MTPs are legally allowed. Okay. To avoid such unwanted pregnancies. So to get rid of unwanted pregnancies, either due to casual unprotected intercourse or a failure of contraceptive use during this coitus or rapes. In all these three cases, unprotected intercourse, then failure of the contraceptive. Sometimes the contraceptive method may not work out. So such cases also pregnancies may happen. Then during this rape or such cases, there will be unwanted pregnancies, right? So to avoid such cases, this MTPs are allowed. In these cases, MTPs are essential. We can't avoid them. And MTPs are also essential in certain cases where continuation of the pregnancy could be harmful even to the mother or to the fetus. Maybe in some cases we can detect that if that growing fetus, that may affect that mother's health as well as the baby's health. Both won't be in a good condition. If that pregnancy period is moving forward, it may cause bad effects or the fatal, it may be fatal either to the mother or to the fetus or to both. In such condition also, these MTPs, medical termination of pregnancies, that may be essential or we can't avoid. In such situation, we can't avoid this MTP. Okay. So to get rid of unwanted pregnancies, either due to unprotected intercourse or due to failure of contraceptive or due to rape, all these three cases, that unwanted pregnancies we need to avoid means we need to use medical termination of pregnancy. We need to take the help of medical termination of pregnancy. So this medical termination of pregnancy, in some cases, if the growing fetus, it may create fatal effects either to mom or the fetus. In such cases also, they are forced to do the termination of that pregnancy. So, in both conditions, medical termination of pregnancy is essential or unavoidable. We can't avoid. Then, so these MTPs, generally they are considered safe up to 12 weeks. That means the first trimester of pregnancy. During the first trimester of pregnancy or the first 3 months, this MTPs, medical termination of pregnancy, it is safe during first 12 weeks of pregnancy or the first trimester. Okay, the pregnancy period during the first 3 months, it is safe. And after that, it becomes risky. Means second trimester onwards, that abortion or medical termination of pregnancy, it becomes risky. Why? Because that time the fetus becomes more connected or more attached to the mother's body. See, the fetus is growing continuously, right? So that growing fetus will get more attached to the body of the mother, right? So it will become difficult to remove that. That's why during first trimester, that MTPs are comparatively easy and safe. And most of the illegal MTPs, illegal medical termination of pregnancy, that are mainly done by unqualified doctors or unqualified medical practitioners. So such kind of things should be avoided. So in this kind of MTPs, it is unsafe. And next, another trend is misuse of amniocentesis. What is amniocentesis? The use, that is the sex determination of the unborn child or fetus. Amniocentesis means the sex determination of the unborn child or fetus. That is called as amniocentesis. So MTPs in amniocentesis, if the fetus is female, that MTP right? That is illegal. Killing the girl child or girl baby, that is against the law. Okay. So medical practitioners, without any specific reason, they will not do the sex determination of the growing fetus. Okay. During pregnancy period, at any cost, they are not supposed to declare the sex of the baby. Before birth, no one should check the sex of the baby. There should not be any sex baby. So, and they are safe up to 5% of that. Most of the doctors and pregnancies, it is done this risk. Another thing done is amniocentesis, that means the sex determination of the unborn baby or a growing fetus. So the fetus, if it is a female, MTP is usually done. That is against the law. Law won't support such type of MTPs. Will get punishment if you are doing like that. So in most of the cases, before birth, no doctor will declare the sex of that growing fetus. It is against the law. And in the world, around, just now I said around 40 to 50 millions of MTPs are done in a year. Yearly, there are 40 to 50 million MTPs in the world. That is around 1/5 of number of pregnancies, right? So 1/5 of number of pregnancies, among that MTPs are done, right? 40 to 50 million MTPs in a year. That is around 1/5 of total number of pregnancies. So there are two types of MTPs, like spontaneous MTP and therapeutic MTP. Spontaneous and therapeutic. In first one, that means the spontaneous MTP means it happens due to some sudden injuries or something. Spontaneous in MTP, spontaneous medical termination of pregnancy, and that will pass as a menstrual flow. It will go as a menstrual flow. But in therapeutic MTP, if it is in the early stage of pregnancy, that MTP is done with the advice of a doctor. Doctors used to advise, because that if there is a chance of fatal effect either to mother or that growing fetus, doctors may advise for a medical termination of that pregnancy. With the help of a doctor, they can do that, right? Now that law allows the therapeutic MTP up to 28 weeks of pregnancy. I said it's up to 12 weeks, it is easy, or without any risk we can do that MTP. But after the starting of second trimester, it is difficult due to the severe attachment of that fetus to the body of the mother. But legally, it is allowed up to 28 weeks if it is necessary. Up to 28 weeks of pregnancy, up to that, medical termination is allowed. Okay. So medical termination, that should be avoided because they are dangerous to both the mother and the fetus. But counseling is needed to avoid unprotected alters and the risk factor. We need to tell the risk factor involved in the illegal abortions. Okay, so the main thing, dangerous. It is dangerous to mother and fetus means there is a legal chance of medical termination. With the legal protection, medical termination can be done. And we need to provide medical counseling to make sure that people are aware of the legal issues they have to face if they are doing illegal abortions. So these are the things we need to learn about medical termination of pregnancy. Okay. So with the help of a doctor, if that any injurious effects are there in that pregnancy period, that medical termination can be done with the advice of a doctor, only with the advice of a doctor. That is legally protected. Legal law allows that. So up to 28 weeks of pregnancy, it is possible. Then what is the need of MTP, or what are the general reasons to undergo this MTP? What is the need of MTP? If it is injurious to mothers and fetus health, definitely MTP is required, right? So different physical, then medical and physiological, all this, due to all these reasons, this MTP or MTP is important. Physical means what is the physical reasons, or what is the physical importance of this MTP? If a woman is not using contraceptive during sexual intercourse and there is an accidental pregnancy without having any intention, or there is a failure of contraceptive, in such cases we can suggest MTP, medical termination. Then what is psychological reason? A woman is mentally not prepared for a pregnancy period or a month. That time also MTP is suggested. Also, then medical reason. If that pregnancy is harmful, or in some cases, if it is harmful to the mother and the growing fetus, and mother is physically and mentally not prepared, or physical fitness or mental fitness is not proper for a motherhood, that time also it's better to go for a medical termination. And psychological reason, in the sense, in some cases, like these pregnancies, it may arise from any rape or some sexual abuses or such things. In that case, that woman can decide. Woman can decide, or the law allows the medical termination of the pregnancy, because if she is not intended to have, or It could have some psychological as well as a social reason that medical termination of pregnancy is allowed or it is legally allowed. Okay. And what are the significance of this MTP? This MTP helps in get rid of unwanted pregnancies, such as pregnancies which is harmful to the health of the baby, then which is, or the pregnancy which is a result of a rape or something like that. In such cases, MTP is significant. Then it is having an important role. This MTP is having medical termination of pregnancy. It is having an important role in the population, in human population or in the human population explosion. It is playing an important role. Then what are the drawbacks? Drawbacks of this MTP. MTP means sometimes this MTP, medical termination, due to the amniocentesis and after that sex determination, MTP is practiced. So that is one misuse of this MTP, right? And that performance of this MTPs with or some illegal performance of this MTPs means unqualified doctors, medical practitioners, they are performing this MTP means it is against the law. And it may create some social issues also. So in such cases, these are the drawbacks or misuse of that MTP. Okay. Next, we are moving to sexually transmitted diseases. So what are sexually transmitted diseases? Sexually transmitted infections or sexually transmitted diseases, the infection or the disease which are transmitted through sexual intercourse. They are collectively called as sexually transmitted infections or venereal diseases, VD, or reproductive tract infections, RTI, reproductive tract infections. Note down, these are important terms. Sexually transmitted infections means infections which are transmitted through sexual intercourse. It is together called as sexually transmitted infections. Venereal diseases or reproductive tract infections. All these are other names for sexually transmitted infections. Okay. Next, some examples: gonorrhea, then genital warts, trichomoniasis, then hepatitis B and HIV, then AIDS. All these are some common sexually transmitted infections. So among all these, HIV infection is very dangerous one. Okay. So gonorrhea, syphilis, then genital herpes, then hepatitis B, HIV, all these AIDS, all these are examples for sexually transmitted infections. And among them, among all these sexually transmitted infections, HIV is most dangerous. Then infections like hepatitis B, then HIV, these all can transmit, or this can be transmitted by sharing of injection needles, then surgical instruments, then with infected person, then transfusion of, what is that, surgical sharing of, see, if you are injecting one person who is affected with this HIV or hepatitis B, and with the same needle or same syringe we are injecting another person, there should be, or there will be a transfer, a chance of transferring of these diseases from one person to another person. So there should not be any sharing of injection needles or surgical instruments between an infected person and an infected person. And then blood transfusion. Through this also, this kind of HIV, then hepatitis B and all, will get transferred to from one person to another person, from an infected person to another one. Then from mother to fetus also chances are there. So what I'm saying is sexually transmitted diseases, this hepatitis B and HIV, both are sexually transmitted diseases, but there are some other reason. Not only through this sexual intercourse, there are some other reasons also for the transmission of these diseases, like sharing of this injection needles, surgical instruments, and blood transfusion, then from mother to fetus also. Then except this HIV, hepatitis B and genital herpes, all these things, it's difficult to cure. And all other diseases which I said, like gonorrhea, syphilis and all, these and all can be treated properly and it is curable completely. It's completely curable. All these other diseases except hepatitis B, HIV, then genital herpes. Except these three diseases, all other sexually transmitted infections can be cured completely if it is detecting at proper stage. Okay. Then see, all of these diseases, they have some early symptoms like itching, then slight pain, then swelling, then discharge of fluid in the genital region. So all these sexually transmitted infections, most of the infections, they have some early symptoms like itching, then fluid discharge, then slight pain, then swelling, and all these in the genital region. So mostly in females, they won't show any kind of symptoms. So detection is also very difficult. And the detection may get delayed due to lack of the symptoms. So there won't be any kind of symptoms in most of the women. So they will leave it or they will neglect that. So they won't be able to detect that in an early stage. So the detection will get delayed. So the treatment also may get delayed. So if it is detecting in the early stage, it is very easy to detect and cure. If only in the early stage, it is very easy to detect and cure. So in the sexually transmitted infections, important thing is early detection and treatment. The one and only method, or we need to follow the early detection and treatment. That is very, very important in the case of sexually transmitted disease. So the absence or the negligence of this detection and treatment, that may lead to complications. So the early symptoms of this disease, it's itching, then fluid discharge, slight pain, then swelling, and all this in the genital region. In the genital region, we'll get slight pain, discharge of fluid, then swelling, then itching. These are the symptoms of the sexually transmitted infections. And the infected females, most of them won't be showing any kind of symptoms or asymptomatic. So the detection also won't happen at the early stage. Then less significant symptoms in the early stage of infection and delayed detection. All this will make the disease complicated, because early detection and early treatment, that is the easiest way to cure this disease, sexually transmitted disease. So the delayed detection, that will lead to complication. Later, that may lead to complications. So this STIs or sexually transmitted diseases, they are Actually, they are a threat to healthy society, right? Medical treatments, everything we can provide for to make a healthy society. But the earlier detection, that is important in the case of sexually transmitted infections. So to get a healthy society, this STIs, the STIs or sexually transmitted infections are a threat to that healthy society. So the prevention and early detection, that is the important things they need to do to get a healthy society. And to cure this disease, they need to give a or main or important consideration under our reproductive health care programs. Early detection, we need to mention in a reproductive health care program, we need to give emphasis or importance to early detection, treatment and cure of the sexually transmitted diseases. All of them, all people or all person may get this kind of infection, and their incidence, the incidence of the sexually transmitted infections, they are very high among the people between the age group of 15 to 24. 15 to 24. So in which age group that you are belonging to, in that age group, 15 to 24, in this age group, all these diseases are reported in a very high rate. So no need to get tense about all these diseases. There is a medical treatment nowadays. It is the early detection and early, we can prevent the disease. And if it is not able to prevent, we can cure with the help of early detection. Then how one can be free of these infections? See, the first and main things, the chapter is included in 12th standard. The main concept is to create awareness in this age group. That's why in this age, they are teaching about this reproductive organs, all reproductive changes in the body. So the main aim is to create awareness among children, those who are in this age group. So one could be free of these infections with the simple principles given below. Let's see which are the important principles which we need to follow. Avoid sex with unknown partners or multiple partners. Okay, avoid sex with unknown partners and multiple partners, and always use condoms during coitus, because we have just now we have told it is seen mostly in the case of 15 to 24. In that age group, the sexually transmitted diseases are reported in a high rate. Okay, and in the case of doubt, one should go to a qualified doctor for an early detection and to get complete treatment if diagnosed with infection. See, I said not only the sexual intercourse, there are so many reasons like blood transfusion, then surgical instruments, use of surgical instruments or sharing that surgical instruments between people. All these may create this kind of sexually transmitted infections like AIDS, hepatitis B and all. So in case of doubt, one should go to a qualified doctor for the early detection and get complete treatment. Okay, so avoid sex with unknown partners or with multiple partners, and always use condoms during coitus. And in the case of doubt, if you have a doubtful conditions, because not only the sexual intercourse, that other blood transfusion, see, if any accident or something is happening, there is a chance of blood transfusion. That time and all, we need to take care. And there is a surgical instrument usage during that period. So that time and all, if any infected person is there, the same surgical instruments are sharing with another person, there is a chance. There's a chance of sexually transmitted infections. So in such cases, if you are getting any kind of doubt, better to get the consultation with a qualified doctor and early detection and get complete treatment for an infection. The next is infertility. What is infertility? See, in the world, there are so many infertile couples. Means they are not able to produce a child. That case, they are called as infertile. And there are so many reasons for this infertility. That may be physical reason, congenital reason, then diseases, drugs, immunological or physiological reasons. So there are so many reasons for this infertility. That may be physical, then drugs, immunological reasons may be there, or even physiological reasons may be there. So in India, there is a tendency to blame female if they are not getting a baby after their marriage. There is a common tendency to blame a lady, or always they'll blame the female part among the couple, right? So more often the problem lies with the male partner. Majority of the cases, male partner will be having the problem. Whatever may be, there is a tendency to blame the ladies, right? That's a common tendency of the community. Then the specialized healthcare units like infertility clinics, if you're going for the help of a doctor or medical practitioner, we can take the help of them and we can diagnose and we can take correct treatment. So in the case of infertility, specialized healthcare units or infertility clinics are there that could help in diagnosis and correct treatment of some of these disorders, and that enables this couple to get a baby, or the chances of getting a child, it is more, right? So where such corrections are not possible, the couple could be assisted to have children through certain special technique. They are commonly known as assisted reproductive technologies, or ART, assisted reproductive technology, ART, assisted reproductive technology. No doubt, assisted reproductive technology means if through that diagnosis or with the help of doctors of infertility clinic, then also the couples, they are not able to get a child or children, then also special techniques called assisted reproductive technologies, or ART, it is followed. Then this IVF or in vitro fertilization. In vitro fertilization, that means, what is in vitro fertilization? The fertilization which is taking place outside the body. It is almost similar to, or the internal condition. It is recreated, and like we are providing the condition which is similar, almost similar to the internal condition. Then fertilization is taking place outside the body, and that after the fertilization, it is followed by the transfer of embryo or embryo transfer, ET. After in vitro fertilization, the embryo is transferred. This embryo transfer, it is another method. Here you can see in vitro fertilization. And in this method, the test tube baby program. Have you heard about the test tube baby program? Means ovum from the female and the sperms from the male. They are collected and that are induced to form a zygote. Here you can see the ovum is collected and from the female, and from male that sperm is collected, and here it is induced to form a zygote, and under laboratory condition all these are taking place. Under laboratory condition, the fusion of this egg and sperm that is taking place. In vitro fertilization. Okay, fertilization in vitro condition means it is outside the body, and after that the formed embryo will be transferred to the body of the female. Next, the zygote or that early embryo. Now the embryo is formed. In vitro fertilization happen, and in vitro fertilization we are going to learn about ZIFT. ZIFT. Zygote intrafallopian transfer. Zygote intrafallopian transfer. We have learned about fallopian tube. Then we know what is zygote. That's zygote intrafallopian transfer. That is called as ZIFT. And the zygote or the early embryo, which is up to 8 blastomeres, 8 cell stage, 8 blastomeres, that can be transferred into fallopian tube. Zygote intrafallopian transfer. The zygote is formed. In vitro fertilization happen. After that, ZIFT. What is ZIFT? That zygote or 8 cell stage, 8 blastomeres, 8 cell, that blastomeres with 8 cells, that can be transferred to fallopian tube, right? Where that fusion is taking place? Inside fallopian tube. So after fusion, we have already made that zygote through in vitro fertilization. Fertilization over outside the body in vitro condition. That zygote is going to, or it is transferred to the fallopian tube. That is called as ZIFT. Zygote intrafallopian transfer. Zygote is formed and that is transferred to the intrafallopian part. Okay. Then embryo more than 8 blastomeres. If it is up to 8 blastomere, ZIFT can be done. Then more than 8 blastomere into the uterus. See, if it is more than 8 blastomeres, we can directly transfer that to the uterus. Then it will complete the further developments, right? First, if it is up to 8 stages, 8 cells or 8 blastomeres, it can be transferred to fallopian tube. This is important part for NEET exam. Up to 8 cell, 8 blastomeres means ZIFT, ZIFT, zygote intrafallopian transfer. After that, that means more than 8 blastomeres means IUT, intrauterine transfer. Intrauterine transfer. It is transferred to uterus to complete the development. See, if ZIFT is done, then again it should move to the uterus and complete the development. But if it is more than 8 blastomeres, it is directly transferred to the uterus, intrauterine transfer. Okay. Then embryos formed by in vivo fertilization. That means fusion of gametes within the female. That also could be used for such transfer to assist those females who cannot conceive. Okay. So zygote, ZIFT means up to 8 blastomeres. More than 8 blastomeres means IUT, intrauterine transfer. Got it? You should learn the difference. Next is ZIFT. What is that? Transfer of an ovum collected from a donor into the fallopian tube of another female who cannot produce one but can provide suitable environment for fertilization and further development. It is another method. Okay. Which is that? What is GIFT? ZIFT means the transferred or the fertilized zygote is implanted in the fallopian tube. That is ZIFT. Then IUT means intrauterine transfer. In that, fertilization happen and it's more than 8 blastomeres. Then it is transferred to the uterus. But in the case of ZIFT, what is that? Ovum, which is collected from a donor. Ovum is from donor. See, some females, they won't be having the ability to produce ovum, a proper ovum. So instead of that, they will collect the ovum from a donor. But this female who is not able to produce an ovum, she'll be having the ability to give an atmosphere or to provide a suitable environment for the fertilization and for the growth of this fetus or the zygote. But there won't be any proper ovum formation. So in such cases, there will be a donor for the ovum. Ovum donor will be there. That ovum will be collected from a donor and then it is transferred to the fallopian tube. Then as usual, the procedures of the fertilization will happen and growth of the zygote also will happen in the same female. Okay, there is a donor of the ovum in the case of GIFT. Gamete intrafallopian transfer. In that, gamete is transferred from a donor, it is collected and transferred to the fallopian tube. Okay. Then this infertility in that in vitro fertilization in this intracytoplasmic sperm injection, that is another specialized procedure, that is form an embryo in the laboratory. In that, sperm is directly injected to the ovum. In that, sperm in vitro fertilization, this type of in vitro fertilization, intracytoplasmic sperm injection, intracytoplasmic, that to the cytoplasm of the ovum, the sperm is directly injected. That is called as intracytoplasmic sperm injection. So different types of in vitro fertilization you need to learn, and in each one what is happening, that should be clear. So in intracytoplasmic sperm injection, ICSI, in this, directly to the cytoplasm of the ovum, the sperm is injected. Okay. Then infertility cases, either due to inability of the male partner to seminate the female or due to very low sperm count in the ejaculates. See, the infertility may cause due to some reasons like the male partner there is no insemination. The male partner don't have the ability to inseminate, or the insemination is not happening in the male partner, or in some other reason like sperm count, the count of sperm. We told millions of sperms are ejaculated during a ejaculation, or it is coming out during an ejaculation, and from that only one so many sperms will be moving towards an ovum, and in that only one is getting fertilized with the ovum, right? So in some cases, sperm count will be very less. Okay, in such cases also infertility may happen, and this could be corrected by artificial insemination, artificial insemination, AI technique, artificial insemination technique. So in this, the semen is collected either from the male partner or from a healthy donor. As we collected ovum from a healthy donor, here the semen is collected from a healthy donor or a male partner, and it is artificially introduced into the vagina of a female or the female partner. Okay, it is artificially introduced into the vagina or to the uterus of the female. This is called as IUI, intrauterine insemination. Intrauterine insemination means if the semen is collected either from the male partner or husband, or it is or from a healthy donor, and it is artificially introduced into the vagina or the uterus of the female. Okay. Okay, then this is the last slide. So through the options, all these options, these techniques or through all these options that professionals are doing, or the doctors with good medical practitioners are doing all these techniques, or they are applying all these in vitro fertilization techniques. So, but what is the problem? These are available only to few people, right? Because it is costly and it is not affordable to many of the people. So it is not reached everywhere. So those people, those who are financially well, only those people can go for such things. So infertility is again a problem. Those who are having a well financial condition, only those can approach such conditions, right? So it is affordable only to a limited number of people. That is the negative side of this in vitro fertilization. And in some cases, it is against the religion. In some religion, this is not allowed, this in vitro fertilization and all, right? So these are the negative sides of in vitro fertilization, because the its cost is not affordable and it's not available everywhere. This kind of fertilization techniques are not available everywhere. So it's not reachable, and means it is out of reach for like cities and all. This will be available. So many of the people are not aware of this. That is one thing. And another one, it's costly, so it's not affordable and it's not available everywhere. And in very less cases, it is against that religion. Like there is an emotional, religious and social factors that is also there in the case of in vitro fertilization, because all are not ready to see. If they don't have a baby, a couple don't have a baby, they are not ready to accept all this. Because if you are accepting a ovum from a donor or the sperm from a donor, they are thinking that it's against the ethics, or it is creating some kind of emotional effects, right? Or it is against our religion. So such kind of thoughts, that also makes people to go away from such in vitro fertilization techniques, or to in making use of such techniques. Okay, so that's all about in vitro fertilization. Thank you so much. I took so much of extra time, I think, so sorry.